Welcome to the English Master Channel, the podcast that helps you improve your English for real-life situations. I'm your host, Kim.
And I'm Pete. It's great to be back with you all.
Today, we're tackling a topic that can be stressful for anyone, especially if you're in a new country or speaking a second language, healthcare.
That's right. Going to the doctor can be intimidating. You need to understand specific vocabulary and be able to communicate clearly about your health.
Exactly. So in this episode, we're going to walk you through the entire process, step by step, from making an appointment to understanding what the doctor tells you.
We want you to feel confident and prepared the next time you need to see a doctor. So where should we start, Kim?
Let's start right at the beginning, making the appointment.
Right. This is usually the first hurdle. You need to call the doctor's office, or what's sometimes called a clinic.
And when the receptionist answers, you can start by saying something really simple and polite, like, "Hello, I'd like to make an appointment to see a doctor, please."
That's a perfect opening line, simple and clear. Now, they might ask if you are a new patient or an existing patient.
Right. An existing patient is someone who has been to that clinic before.
Exactly. But if it's your first time, you'll say, "I'm a new patient." They'll probably need to get some basic information from you then, like your name, date of birth, and phone number.
Yes, and a very important question they'll ask is, what is the reason for your visit?
Uh-huh.
And this can feel a bit tricky, but you don't need to give your entire medical history over the phone. You can be quite general.
Right. So what are some examples?
Well, you could say, "I have a sore throat," or "I'd like a general checkup," or even just, "I'm not feeling well."
That phrase, general checkup, is a really useful one. It just means a routine visit to make sure everything is okay, not for a specific problem.
Exactly. Then there's the topic of insurance. They will almost certainly ask, "Do you have health insurance?"
Of course, so you'll want to have your insurance information ready to give to them.
It makes the process much smoother. How about we do a quick role play?
Great idea.
Okay, Pete, you be the receptionist at the doctor's office, and I'll be the patient calling to make an appointment.
I'm ready. Ring ring. Good morning, City Medical Clinic. How can I help you?
Hello, I'd like to make an appointment to see a doctor, please.
Of course. Have you been to our clinic before?
No, I'm a new patient.
All right, I can help with that. Can I get your full name and date of birth?
My name is Kim Johnson, and my date of birth is May 15th, 1990.
Thank you, Kim. And what is the reason for your visit today?
I've had a bad cough for a few days.
Okay. The next available appointment with Dr. Evans is tomorrow at 10:30 a.m. Does that work for you?
Yes, 10:30 a.m. is perfect.
Great. Do you have health insurance?
Yes, I do.
Okay. Please bring your insurance card and a photo ID with you to your appointment. We'll see you tomorrow at 10:30.
Thank you so much. Goodbye.
And that's it. See? Not too scary. The key is to have your information ready and use those simple, clear phrases.
So, you've made your appointment. Now it's time for the visit itself. The first person you'll talk to is the receptionist at the front desk.
Right. You'll want to check in for your appointment. You can walk up to the desk and say, "Hello, I have an appointment with Dr. Evans at 10:30 a.m. My name is Kim Johnson."
Exactly. They will then likely hand you some paperwork to fill out. This is very common for new patients.
These forms can be long. They'll ask for your personal information, your insurance details, and your medical history.
Medical history is just information about your past health. Things like allergies, previous surgeries, or any long-term health conditions you have.
It's a good idea to arrive about 15 minutes early for your first appointment so you have plenty of time to fill out these forms without feeling rushed.
That's a great tip. After you give the forms back, you'll usually wait in the waiting room until a nurse calls your name.
The nurse will probably take you to a smaller room to check some basic things. They'll check your vital signs.
Vital signs include your blood pressure, your temperature, and your heart rate. They might also ask you to step on a scale to check your weight.
Right. The nurse might also ask you again, "So what brings you in today?" This is another chance to briefly explain your symptoms before the doctor comes in.
And this is probably the most important part of the visit, talking to the doctor.
Absolutely. Being able to describe your symptoms clearly can help the doctor make an accurate diagnosis.
Let's start with pain. If something hurts, you need to describe where it hurts, what kind of pain it is, and how bad it is.
Okay, so for the location, you can say, I have a pain in my, and then name the body part. I have a pain in my chest, or my left knee hurts.
Right. And for the type of pain, there are some really useful adjectives. For example, is it a sharp pain, like a knife, or a dull ache that is constant?
Other good words are throbbing, which means the pain comes and goes in a rhythm like a heartbeat, or burning, which feels hot.
You should also tell the doctor how severe the pain is. They might ask you, on a scale of 1 to 10, with 10 being the worst pain imaginable, how would you rate your pain?
That's a very common question. It helps them understand how much it's affecting you.
Beyond pain, you should describe any other symptoms. A symptom is any feeling of illness or physical change caused by a disease.
For example, if you have a cold, your symptoms might be a runny nose, coughing, and sneezing. If you have the flu, you might have a fever, body aches, and fatigue.
And fatigue is just a word that means you feel very, very tired. Some other common symptoms are nausea, which is when you feel like you might vomit. Dizziness, when you feel like the room is spinning, or a rash, which is a red area on your skin.
The doctor will also want to know about timing. When did the symptoms start?
You can say, it started 3 days ago, or I've been feeling this way since Monday.
They might also ask, is there anything that makes it better or worse? For example, the pain gets worse when I walk, or it feels a bit better after I rest.
The more details you can give, the better. Don't be shy. The doctor is there to help, and they need this information.
Let's talk about some other common problems. What if you have a stomach issue?
Good question. You could say, I have a stomach ache. You can also be more specific. I feel nauseous, or I have indigestion. Indigestion is that uncomfortable feeling in your stomach after eating, often with a burning sensation.
Okay, so after you've described your symptoms and the doctor has examined you, they will give you a diagnosis. And what about headaches? I have a headache is simple, but like pain, you can describe it more. For example, I have a migraine, which is a very severe, throbbing headache.
A diagnosis is the identification of the illness. For example, the doctor might say, it sounds like you have the flu, or you have a sprained ankle.
Sometimes the medical terms can be complicated. It is perfectly okay to ask for clarification.
Yes, absolutely. You can say, I'm sorry, I don't understand. Could you explain that in simpler terms?
That's a fantastic phrase. Another good one is, what does that mean exactly? Never be afraid to ask questions.
After the diagnosis, the doctor will recommend a treatment plan. This might involve getting a prescription for medicine.
A prescription, or script for short, is the doctor's written order for a medicine that you take to a pharmacy. The person who gives you the medicine at the pharmacy is called a pharmacist.
When you get a prescription, you need to understand how to take the medicine. You should ask, how often should I take this? And should I take it with food?
Also, ask about side effects. Side effects are unwanted effects that a medicine might have. You can ask, are there any side effects I should watch out for?
Good point. The doctor might also recommend rest or specific exercises, or they might say you need more tests like a blood test or an X-ray.
And finally, before you leave, make sure you know what the next steps are. You can ask, do I need to schedule a follow-up appointment?
A follow-up appointment is another visit to check on your progress. It's important to know if you need to come back.
To summarize, when you get a diagnosis, don't be afraid to ask, what is it? What's the treatment? And what are the next steps?
And that brings us to the end of our guide to navigating healthcare conversations in English.
We hope these phrases and tips make you feel more confident. Remember, clear communication is key to getting the care you need.
Practice these phrases and don't be afraid to ask questions. Your health is the most important thing.
Thanks for tuning in to the English Master Channel. Join us next time for another episode.
Until then, keep practicing. Goodbye, everyone.
Bye.